Hi there, everyone. I'm Jenny Alison. I'm a professor of respiratory physiotherapy at the University of Sydney and professor of allied health in Sydney Local Health District. I wish I could say it was something really kind of ethereal and important, but really it was because I had a cousin who was a physiotherapist and she was really enthusiastic about physio. And I like working with people and it looked like a fun profession. So I thought, it was a choice between maybe physio and pharmacy, and sorry, pharmacist, but I didn't think I'd like working in a shop or a pharmacy, so I chose physio. So I suppose one of my biggest things is the PhD students, especially the clinician PhD students who are clinician researchers, that really, I've had the privilege to supervise quite a number of clinician researchers. And they've gone on to teach the next generation of physios and to change physio practice through their research. So that is a wonderful opportunity to have an influence on that next generation of physiotherapists and researchers. I think one of the other things, I was thinking about was, the opportunity to work with larger organizations. My area is respiratory physio, as you heard from the introduction, and I work with Lung Foundation Australia, and it's where you can get a bigger impact for the work that we all do. Things like making evidence-based interventions more widely available. I've worked with a team to develop the Pulmonary Rehabilitation Toolkit, which is widely used in Australia and internationally. We put a training program online for training clinicians in pulmonary rehab. And, there's greater opportunities for advocacy when you're working with large organizations that are specific to your area. So that's been a really great thing for me, and I'm proud of being involved with that organization and others like the Agency of Clinical Innovation. One other thing I was thinking was more recently, well, that's recent, but more recently, I received an NHMRC research grant, which in implementation science, which is a relatively new area of science, which has enabled myself and others to work with Aboriginal community-controlled health services to trial the implementation, partner with them to trial the implementation of pulmonary rehab in culturally safe environments. And if you don't know about Aboriginal health, there's a big gap in outcomes for Aboriginal people. And Aboriginal people don't always like to access mainstream services. And this was work to enable these Aboriginal medical services to provide pulmonary rehabilitation. And to be honest, I have learned so much from those Aboriginal communities about what it really means to be a member of a community, and really how we should be doing research, even in our mainstream research, in partnering with organizations and listening to what they need and what they want. So that's been a great highlight for me, and working with my Aboriginal PhD student, from whom I've learned a lot as well. Yeah, they're the three main things. The only other small one was, there was a time when our pulmonary rehabilitation program in our tertiary hospital was not really able to continue. And myself and one other clinician stepped in to try and make sure that didn't disappear from our service. So that was important for us for the long term. Well, look, I think, one thing I've often said to people is, if in doubt, say yes. In other words, you're given the and now I know it can stretch people a lot, and I know we've got a balanced life, but to be honest, what happened in this instance was I was invited to be on a committee for the Lung Foundation Australia because of the work that we were doing in pulmonary rehabilitation at the time. And this is many, many years ago. And contributing to meetings gave you a profile that enabled them to then step up wanting to write the pulmonary rehab toolkit to bring everybody together across Australia rather than lots of little things happening. So being on committees to begin with, and then speaking up and developing your profile enabled you to be invited further on to be involved in advocacy and lead other things. So it often starts from a small beginning and then being recognised for what you can offer in that space. Yeah, that's a good question. Look, I think two things: autonomy and evidence-based practice. So when I say autonomy, way back when I started being a clinician, the doctors actually prescribed what you did as a physiotherapist. We really didn't have first contact practitioner rights. And so what's changed dramatically over the years is the fact that we're recognised as a profession that has our own skill base and can prescribe our own interventions for patients when we assess them and decide what is with the patient, what is the most appropriate intervention. And leading on from that, I think, I said autonomy and evidence-based practice, but in the evidence-based practice space, way back when I was a fairly new graduate, I started to teach in physio and do clinical education. And honestly, I used to stand up in front of a class and be teaching things that we really had no evidence for at all. So I actually left physio. I felt that I couldn't continue to do this. So I went back to work in a respiratory laboratory to gain skills in measurement and better understanding of how we could gain the evidence for what we were doing. And I was very lucky in having a terrific mentor who was a clinical scientist who really taught me the basic skills around research and furthered my interest in inquiry, I suppose, and how to measure what we wanted to answer in those questions. And we've seen an exponential increase in physiotherapy research that's actually led by physiotherapists. In the past, any research really was led by the doctors wanting to know something, but not led by physiotherapists. And I think PEDro, the Physiotherapy Evidence Database, is a huge example of the exponential increase in evidence for physiotherapy interventions, which is a wonderful thing to see. And that evidence has really enabled us to be well respected and recognised by other practitioners, especially medical practitioners. And the importance of that is not only the recognition, but the fact that that means that those medical practitioners in managing a patient will also integrate our practices and refer patients for what we can do to enable the patient to get the best care that they can get. So I think that's been a really big change in my time. There is one thing. When I got a bit disgruntled with physiotherapy and lack of evidence, I managed to enroll in, we were living in England at the time, and I enrolled in a Master's in Human and Applied Physiology, which was the most amazing applied physiology Masters. And that really cemented my love of physiology, but also gave me the skills to do more measurement and also to understand responses of patients to the interventions that we were applying. I mean, we did a lot of different parts of physiology, not just exercise physiology, but effects of heat, effects of altitude, effects of depth in submarines, flying at altitudes, etc. But all that does give you a physiological background to understanding the physiological consequences of the interventions that we do. So I think that really did help to change my practice and the way we measure things and the way we think about why, not just that it changes, but why do we get the changes we get. So that was important. And I think probably the other big thing that changed my practice was actually doing a PhD, learning the measurement skills and the way to ask questions and to hone questions down and to do research that was meaningful to our patients, and therefore, and then because I was working as a clinician as well, being able to integrate those findings pretty rapidly into actual clinical practice. Yeah, I think the bright young students who actually want to be physios in the future, I think that's very motivating to see the quality of the students that we teach in universities that want to be physios. The other group, which I think is really inspiring, are the dedicated clinician researchers. These are clinicians who are, really working hard and providing care for patients, but they also eke out some time to do research because they want to improve practice. They have questions that they want to answer from their clinical practice that will actually change outcomes for patients. So they're very inspirational, I think, and that really inspires me. And I suppose the other thing that always keeps us going as physiotherapists, as clinicians, is the benefits you see patients gaining from an intervention, from the interventions that you do. I mean, that feedback from patients who get improved because of what we do is really motivating, I think. I always say to them, don't decide on a specialty area too early. I think it's fantastic if they can get broad experience after graduation to just experience what's out there, because they might change their minds about the type of physiotherapy practice they want to be more involved in. Always keep learning. We get very stale if we don't push ourselves to continue to learn. And also it's not good for our patients either. So I think that, always having an eye to improving your skill base and learning new areas. And I also would say to new graduates, try and get involved in research because it genuinely will increase your interest in any area that you're involved in. And it really makes you a good self-critical clinician because you're asking questions of yourself and of your practice, and did it make a difference? So implementing new things, I mean, translating research into practice, but also doing the research yourself, and makes you gives you a deeper understanding of your practice in a way. Listen to your patients. I think we forget that we learn a lot from our patients, and as new graduates, don't think it's a one-way street that you've got something to deliver to patients. You really need to listen to your patients and partner with them in the interventions you're doing and hear how it goes for them and what works for them and what's important to them. And I think that will make you as a new graduate a better clinician overall. For physios who've been in the game for a fair while, it's important to use your expertise by getting involved in maybe advisory groups or specialist organisations where that expertise could be invaluable. I know I've said, research, but I do also want to say again that if you've been a physiotherapist for a long time and you haven't been involved in research, it may be a way to re-stimulate your practice and to ensure that you are continuing to learn from what you do, and provide that information more broadly to the rest of the physiotherapy profession through doing research and publishing research, especially if you're an experienced clinician and anecdotally you're finding that things happen that haven't been researched, then really, in a sense, you're duty bound to do the research to show with real evidence that it is effective, rather than just anecdotal evidence of different treatments being effective. So yeah, I think research is important. Oh, that's a really good question, actually. I think absolutely. We've just sent up a mentoring program in Sydney Local Health District with experienced clinician researchers, with younger researchers, but also in other aspects as well. And it's been very successful. And I think that it will be showing to be successful. And what has surprised me is how much the mentors have enjoyed mentoring and what they've learned from mentoring younger clinician researchers, and how much the younger clinician researchers have valued the more experienced researchers, not only in research, but in the broader aspects of how to manage your career and profession, even though that wasn't necessarily an intended avenue. So I do think that setting up mentor-mentee programs is mutually beneficial, and physiotherapists who've been working for quite a long time really sometimes don't realize what they know until they meet with younger physiotherapists and realize they have a lot to offer them, but also that the younger physiotherapists have a lot to offer the more experienced physiotherapists in what their novel ideas are. They're bright, they've smart, they've got new ideas, and they've learnt new things at uni. So it can be a really lovely relationship if both parties are very open to that. Yeah, look, I think technology is going to be a big part of that. Technology, well, I think I see it in two ways. Technology to link more rural and remote sites to more central sites to enable people. In Australia, we have a very large population that is in a very dispersed parts of the country, and to have enough health professionals and physiotherapists in particular to provide the kind of evidence-based care that those people living in those more rural and remote sites should be getting is really difficult. So using technology, I think, to link experts with those sites, delivering interventions via technology, using apps, etc., may also be, I think will be a future explosion, which is happening already, but I think it's got a long way further to go. So I think technology is one thing. The other thing about technology, I think, is also enables physiotherapists to upskill more easily. They don't have to travel as much to increase their skill base, to attend courses or to go to conferences. So I think those sorts of things will also be beneficial for our profession more broadly. Hopefully over the next 5 to 10 years, there might be further increased recognition of what we do. There's always been recognition of pharmacological interventions and funding for pharmacological interventions, but I really feel like we haven't been adequately recognized for the value of our physical interventions. Here for me personally, I'm thinking about things like pulmonary rehabilitation, but it's across all physiotherapy, and especially funding in primary care so people can get access to evidence-based practice that can really change their lives. So we know that in Australia, we only have funding for 5 allied health visits across all allied health in primary care. And this is really inadequate to ensure primary and secondary prevention of problems. So I think funding, I'm hoping in the next 5 to 10 years, will become a bigger profile, and we may achieve some better funding options for physiotherapy interventions. Yeah, I think they're probably the main things, that recognition of what physiotherapy practice can do, and making sure that people can get access to it without costing them too much. I think primary prevention is really important. I think there needs to be funding in primary prevention, and especially for physiotherapists working in pediatrics, etc., but also secondary prevention in chronic diseases where we know that if we provide better care, and often that is physical interventions, not pharmacological interventions, we can help prevent some of the sequelae that would come from those chronic diseases, which cause more problems for our patients. And, in lung disease, I often think, what we're trying to do is help people live the best lives they can, live their lives to the max within the limits of their lung disease. But we want that to be with the rest of their body being physically able. So managing all those other parts as well to ensure, both physical ability and psychosocial sort of support as well. So I think those are important parts.